a dressing, okay? But we're going to say we don't have a dressing on this. This is also not a procedure that will be tested on. It is not a procedure that you have to practice. It's not even on the practice card. We'll just do a couple sutures, a couple staples, because these sutures and staples are hard, and staples are expensive to put in. And we need to keep them through my class in the afternoon and the class on evenings. So you only get a couple to take out, not a whole row. Got that? Otherwise I'll have to come over and get you. Now, first of all, when you're taking out sutures and staples, make sure you check your physician's order. What do they want? What do they want in that document? Oh, here they are. Because they can have many different things written, so we have to kind of see. Now, so I saw that we want to take out sutures and staples on this person with, and we want to replace with steri-strips. And so we'll talk about steri-strips in a minute. So I'm in the room, I've washed my hands, I've identified all those things we always do. Now, they have no dressing on this wound. So the first thing I'm going to do is take out staples, okay? Now, I'm going to clean. So this is the patient's head, this is their feet. This is a lot of pretending. So, I have no drain, so the first thing I'm going to do is go down the middle of the incision, one swipe, from the head to the toes, right? Throw it away. Side away from me, because it has no drain. Throw it away. And then the side towards me, okay? Now, as you're cleaning with these, what's nice is, remember, we're healing because probably somebody had surgery or they had a wound that had to be stapled up or whatever. And when you heal, you get scabs, right? And when you pull a staple out with a scab on it, a lot of times you're also pulling the scab. And in an area that's painful, what? Yeah, it can hurt. So, if we can get the little crusties off, that's nice. Okay? That's nice. How many of you have ever had sutures or staples? And did they hurt to come out? Depends upon where they were. If it's a surgical site, yeah, it does hurt because they just did surgery on you. It's a painful area anyway, okay? You know, I don't think you have to cry, but some people have a very low pain tolerance and do, and that's fine, okay? So, we're going to take out sutures. First thing I need is I need a helper. Come here, Amy. This is a real easy helper. I need you to just kind of stand. You're going to have to kind of watch out. Amy needs to hold this pad down for me. You know, real people aren't going to fly up. But I need her to hold it because these do fly because they're only little pads. Now, this is a suture removal. It has teeth, okay? So what I'm going to do is under the first suture, I'm going to put the teeth. I'm going to apply pressure to the handles, and I'm going to pull it up, okay? And it will come out. Now, if it is stuck a little bit, just wiggle it a little bit. You don't have to, okay? Wiggle a little bit. Remember, be nice. Now, what we like to do, and these are kind of close. They put them very, very close. Nobody's going to be this close. Because of this, we're going to go under with the teeth, spread, and pull it out. Now, these are steri-strips. Okay, they're very large steri-strips, but just pretend they're not so large. This was somebody's stomach, it surely would be okay. Every other one, a lot of times, as we take them out, thank you, Amy, we're going to put a steri-strip down. Now, what are steri-strips?
Keep the incision.
Yes, it prevents stress from being on the incision. It prevents stress. So we don't have just nothing here. We have something still holding it together for us. Now, steri strips are kind of like tape type idea, but they have strings in it that really hold. Now, these are very sticky, and they stay on a person for about 5 to 7 days. Depends upon how many showers, how wet they get them. They can get them wet, but don't pull them off, okay, until they're almost all completely falling off. Keep as much as you can. So that is a steri strips. And you see we have a lot of our skin on.
You said you put one about every other.
Every other one. As I take out these staples, I will put a steri strips on. Okay? As I take out the staples and sutures and that kind of thing, I will take off the steri strips. I will put on steri strips. So I don't have anything. Now, as you're taking out sutures or staples, if anything starts to dehiss, stop. Don't do anything more. Call your physician, tell them, hey, I tried to take them out, it didn't work.
If they start to what?
Dehiss.
The edges come apart.
The head just come
Okay.
apart. That fancy word you learned, right? Okay. Now, in the hospital, you really don't get a big chance anymore to take out sutures or staples. Why?
They're gone by then.
Yeah, they're gone. Doctor's office takes them out. The biggest place you're going to be able to take out sutures and staples is in the long-term care facility. Because people come into long-term care facilities for rehab. Okay? So you'll need to take out their hip or their knee sutures and staples. Not that you'll never get a chance in the hospital, but again, they don't stay long. Okay, Miss Amy, I need you again. Now we're going to take out staples. Clean, center, side away, and side toward me. I don't have to do that anymore. I have a forceps. Looks like a tweezers, but it's called a forceps. And I have a scissors. Scissors, we're going to have it like this, where the scissor with a little notch out of it is what's going to go under that suture. Okay? So what I'm going to do is I'm going to, at the knot, take my forceps. Let's see how tight they make these. Oh my God, I think put these in. And I'm going to pull. They'll never be this tight. I'm going to cut, and then in one piece, I'm going to take out the suture and put it in the package. Thank you. Take your knot, pick it up, and like I said, these are really tight. Cut and pull it out. Now again, watch, it's going to be a little rough when it has scabbing and that kind of thing. Okay, hurts a little bit. Okay, so what I'm going to do, just go ahead, I have